was having to make like life or death decisions for myself at like 10 years old. That's,
oh my God.
Yeah, the magnitude of that's crazy. And then I'd go into school when I rarely would be well enough to, and people are talking about homework or who they fancy, and it's just such worlds apart. But
this is so fucking petty.
But I think it was really difficult for me growing up because I had such a disconnect from the people around me.
Yeah.
If I ever was interacting with people my age, it was just, like night and day. It was just not anything that I could understand or relate to on their end, and vice versa.
I mean, how much time were you in hospital for as a child?
So my attendance in year 6 was 18%.
Right.
So I've had 97 operations now since I was 6.
Whoa.
Yeah. So I basically grew up in hospital. So that is something that is very difficult because also, when you're younger, you're kind of a sponge to what's around you, especially. And I've got a lot of trauma from hospital and things like that.
I can imagine.
It's weird that it becomes, my parents and I used to call it our second home, because it was like if I wasn't at home, I was in hospital, and vice versa. And then when from year 5 to like year 9, I would go to America with my parents for treatment every 6 to 8 weeks. So there was no normalcy, there was no, consistency. And just as we were kind of getting back into routine or back into like the rhythm of something and some normalcy, it was like, oh, and we're off again.
Yeah.
So that was really difficult.
Why did you have to go to America for treatment?
Because there was nothing that could be offered in the UK. I had 9 operations in the UK between 6 to 9. And then basically all doctors kind of washed their hands with me and said, there's nothing else that we can do for her. We saw so many different ones. It's because, my condition is a rare one, and it's also, there's no cure for it at the moment. So everything that I have done to me, or that a lot of people with AVMs have done to them, is just to help them keep going and bide time, really, and control some symptoms or lessen them. So
you said AVM there.
It's just the acronym for my condition.
What is that condition?
So it's Arteriovenous Malformation. So it's
a fucking mouthful,
right? Mouthful and a half. Yeah, that's why AVM.
Way better.
Yeah, exactly.
Yeah. So what is AVM?
So an AVM is a abnormal connection between blood vessels, and it can be in any part of your body. Mine's in the behind my eye, top of my head, and also cheek and gums. But then you can get one in your brain, and that's actually more common. So mine affects, a facial one affects 3 in a million, but maybe one in the brain would affect like 1 in 50,000. And you have to be born with it, but it can become active at any age and then be dormant till that point. So that's what happened with me at 6 years old.
3 in a million?
Yeah, 3 in a million.
Fuck.
Yeah, it's crazy. So it's basically when you're like being formed in your mum's belly, a genetic switch that should turn off doesn't.
Right.
And so it's just a fault, basically.
Right.
And so it means that in between your arteries and capillary and your veins, you have capillaries, and they kind of like balance out the pressure of them.
Right.
But in someone who has an AVM, in that area, they don't have the capillaries where they need to be to balance out the high flow of one and the low flow of another.
Right.
So they directly collide into each other, causing like a build-up of pressure, pain, and for me, the worst part about it, which is the life-threatening bleeding, which I've had in the past, like nosebleeds, things like that. For someone with a brain one, brain bleeds internally.
Yeah.
And obviously change to appearance and swelling.
Yeah.
And things. Yeah.
When you say you've had in the past, you've suffered with that quite a lot, haven't you?
Yeah.
Yeah. I heard you talk about it, and like you were saying that you always had to. I'm sorry if this is uncomfortable.
Oh my God, not at all. Not at all.
You always had to kind of carry tissues around with you. Because you were always scared it was
always in the pocket. Yeah. It became so part of my daily existence that I've had days where I've had like 9 nosebleeds in one day, and then I've had other days where I've had 1 nosebleed out of nowhere, but it's been so bad that I've been hospitalized and put into intensive care. So the most difficult part of it is that I never know when they're coming on, really.
Yeah.
So there's zero control, and you're kind of always in this hyper alert, hyper aware, hyper vigilant kind of.
That must be so anxiety.
State.
driving.
It is, yeah. I don't really ever relax. I'm always like, I have so many things I do that I can't unlearn because they're just so implemented into me. So like, I really grip my teeth. I really clench my jaw.
Yeah.
I will like, pick at, parts on my fingers because it's just like nervous kind of ticks because I'm always just like, okay, where is the exit if I need to leave for if I have a bleed or something? And I will also avoid places if they're not easy to leave.
Right.
So that,
So for instance, like it must be
like I'm never going to go to a club or like a concert or things like that because they're not easy to leave.
Yeah.
So if I do go to a concert, it will have to be in a case where, okay, I know someone is nearby that I can kind of just try and get out.
Yeah.
But I'm not going to be standing, you're trying, because that's
never going to go to a fucking middle of a festival.
Oh, no way. Yeah, no way. The amount of festivals I've been invited to, and I'm like,
I can imagine.
Thank you, but no, thank you.
Yes, not for me.
Not happening.
Yeah, man.
Yeah. No, that's the thing is quite a lot of my livelihood in that sense has been difficult as well because there's been things that I'll just never do. I don't really go on public transport ever because, especially at rush hour, it's a no-go.
Yeah.
You're trapped.
You're not missing anything.
No, I know.
But it's fucking difficult to navigate that without
I'm either getting cabs around or, my parents have driven me around. So it's all these tiny things that in grand scale do make a big difference. So
absolutely,
it's difficult because it's things that I think growing up I often felt like, I spent a lot of my childhood kind of apologising for it. When I finally had friends, it was like, sorry, I can't go on the train. Can we do this? It was like
you had to apologise.
Yeah.
Fuck, yeah. When we're younger, we can very easily fall into this victim mentality, whereas it's so unfair. It's all me.
Yeah.
So, and I don't see that with you. Which I've had so much in my life, and I've got really nothing to fucking talk about, really.
Oh, no, yes, you have.
But then, well, I heard a saying that the worst thing that's ever happened to you is the worst thing that's ever happened to you.
Yes.
And in relation,
oh my gosh,
so that's always the same for everybody. So whatever it is on whatever scale, it's the worst thing that's ever happened to you. So you're going to feel that way about it. But then I heard you talk about therapy quite a bit, which you said has been amazing for you.
Yeah.
What age did you start having therapy, and how did that help?
So I started having therapy young. I kind of, as I started treatment and seeing doctors, was sort of put into therapy in at age 8 maybe.
Right.
It was just like the in-house hospital therapist. It wasn't anything outside of hospital, which I think, looking back now, I wish wasn't the case because I think then your mental and your physical health are both in the same place.
Absolutely. Yeah, you're so right. Yeah.
So for me, it was also the place that I had a lot of trauma from, was also where I was going to for my therapy session.
Oh my God. Yeah. So you're, oh my God.
It was actually hell at the beginning.
Yeah.
And I'm so glad that that is not what I've done in the last few years.
Yeah.
And also back then, I don't really think I got much out of therapy because I didn't really know how best to utilize it. And also, I think I would just stick with people that I didn't really click with out of politeness when I knew it wasn't working.
I've done that.
Yeah, because I just don't want to hurt someone's feelings. So I'm just like, I'll go to the sessions, I'll, nod my head, or, but actually, so I first started going to therapy for coping with pain. I was having really severe pain from a very early age, and a lot of medications and painkillers didn't work.
Right.
So for me, it was trying to find other coping mechanisms in a little toolbox for me to grab from, because if there's nothing I can take from my pain, and I'm just left in agony. So it was just trying to at least talk about pain or try and find some other coping mechanisms, whether it was like breathing or whatever it may be, and also just a place to really talk, I guess. And then after that, I have a lot of needle phobia because I have had so many traumatic experiences with needles and out of hospitals. So for me, then I had therapy for that, and that hasn't really helped because I think it's so ingrained. It's not necessarily something that you can change, but it just helped at least with kind of thinking about. Again, I think everything for me has been just more trying to find coping mechanisms rather than expecting things to just be like, and I'm fine.
Absolutely, because I think that's the thing, isn't it? When you talk about something like PTSD,
oh my gosh,
post-traumatic stress
that's
disorder.
it. Post.
You're not in the post.
I'm in it.
So you're like, no, how do I deal with this? Because it's going to fucking happen soon.
Oh my gosh, that's it. And I think I went into therapy expecting to have it, and I'm fine, because it was like, okay, if I can't, solve anything in terms of like physical medical health, then at least maybe mentally I can. And that's like, okay, I've actually got somewhere, light to the end of the tunnel. But that also didn't happen, and I obviously didn't understand the magnitude of how not easy it is. But yeah, I think that was difficult for me, because then I was like, what's the point? Why? I kind of shut down as well. So I think I also kind of would tell my kind of therapist initially like what they wanted to hear, because I was just like, I've already accepted that this isn't working. For me, it's complex PTSD. There's two different strains, either post-traumatic stress disorder or complex - post-traumatic stress disorder. And so with complex, it's something that's happened on multiple occasions.
Right.
And it's kind of still a ruminating thing. And obviously, there is post-traumatic events for me that have happened.
Yeah.
That I am dealing with and have trauma from, but it's a current scenario that I'm dealing with that they are a result from. It's not like I'm post my condition. I'm very much in it. And so it's trying to find ways to process those traumas. So I think that's something that in the last 5 years, I guess I'd say, I've really been trying to work on, because there was kind of a point for me, I guess, in 2018. I was in a coma for 8 days.
Whoa.
Yeah. And so I woke up and just really was a broken person. And so it was trying to process the fact that I'd literally just been in a coma for 8 days. And then...
And so you wake up having no recollection?
No, so I remember... So it was as a result of having such a bad bleed that I went into a coma. So I remember being in hospital, having a blood test, and the traumatic kind of situation trying to give me a blood test because of my phobia of needles and things like that. And then a big nosebleed starting, because I was already having a lot of bad nosebleeds. So that's why they were doing a blood test to check my blood levels. And then I remember literally just being in and out of consciousness because I had such a low blood count, and then being wheeled into the operating theatre in my normal clothes, because it was literally so life or death. And then when I woke up, I thought I'd woken up from the operation, not 8 days later.
Oh
so that was so hard for me to get my head around.
Yeah.
And then I also at the same time was having like drug withdrawal from the drugs they'd put me on while I was asleep. So like a drug addict would, but not a drug addict, just going through all of the motions of that, throwing up, the shivers. God. So a lot of it.
So you're on like a morphine style drug or something, like an opiate. So you're coming off of that.
Yeah.
Which I know what that's like, and fucking that's tough anyway. Having had that coming out of an 8-day coma, I can't imagine
and then
how that must be.
And then I had both children either side of me pass away in intensive care. So it was all just very traumatic, like one thing after another. And I had to learn to walk again, had to learn to lift my head again, because I'd literally been lying there still, occasionally obviously move, but like lying there still for 8 days. And what that does to your body is actually crazy how quickly you can go backwards. It's really, it was mental.
When was this, sorry, Nikki?
In 2018.
Wow.
Yeah.
Wow.
Yeah.
So when it comes to therapy,
it's so important to find the right person. It's kind of like dating. You've got to find what makes sense to you and what fits for you. It's not one size fits all. And for me, it's taken me a long time to actually find people where I'm like, this works.